Welcome to Lecture 6, Acupoints for Massage Therapists. This lecture will focus on the heart channel of hand Shaoyin and the small intestine channel of hand Taiyang. So we see here is hand Shaoyin, and not surprisingly, we see Shaoyin has an effect on the center of the chest, right, related to the heart channel. And we see Taiyang, and we can see how closely these two channels are related. Just opposite sides, right? Anterior-medial aspect and posterior-medial aspect of the upper extremity. And posterior-medial aspect of the lower extremity and the posterior aspect of the entire body for Taiyang. And we remember that these areas that tend to be paired are very close to each other. We see hand Taiyin, the lung channel. This is just review here. And just on this is the anterior lateral surface of the arm, upper extremity. And we can't see it in this drawing, but on the posterior lateral surface of the upper extremity is hand Yang Ming, the large intestine channel. And here we see foot Taiyin, the spleen channel that we just discussed. Right? Medial aspect to anterior medial aspect of the lower extremity, just on the other side, right? Just next to Yang Ming, foot Yang Ming, on the anterior lateral aspect of the lower extremity. So these pairs tend to be right next to each other. If you hold out your arm in front of you with your thumb up, you can see along the radial side of the thumb and along the anterior lateral portion of the arm, Taiyin. And if you just shift your hand, turn your palm down slightly, right, you kind of fall onto hand Yang Ming, right, radial side of the index finger and the posterior lateral portion of the upper extremity. On the other side of the upper extremity, if we have our palm up and we run our hand along the anterior medial surface of the upper extremity, that is the Shaoyin area. And just next to it, on the posterior medial surface, is Taiyang, the arm Taiyang. Because we see that Taiyang covers a little bit of the forehead, but really the entire back. Shaoyin, posterior medial aspect of the lower extremity, and anterior medial aspect of the upper extremity. The heart channel of hand Shaoyin originates in the heart and arises from the system of blood vessels that surround the heart. We see it arise here. A branch ascends alongside the esophagus, crosses the face and cheek to connect with the tissue surrounding the eye. Another branch descends through the diaphragm, connects with its paired organ, its paired fu, the small intestine. And another branch moves laterally, connects with the lung, then crosses through the axilla where it emerges, heart 1 in the center of the axilla, and descends along the anterior medial aspect of the upper extremity, crosses the wrist, the radial side of the 5th metacarpal, and terminates at the nail root of the pinky, of the small finger, at heart 9. So the internal pathway connects with the heart, lung, and small intestine. We see that the Luo channel, the connecting channel of the heart, hand Shaoyin, leaves the channel at heart 5, Tongli, connects to the small intestine channel, and then follows the heart channel to connect with the heart itself, and then continues to the root of the tongue and the eye. And the divergent channel separates from the primary channel in the axilla, enters the chest, connects with the heart, and ascends along the throat into the face, connecting with the small intestine channel, its paired channel, at the inner canthus of the eye. Okay. Interesting, if you think about where people have symptoms, if they have some kind of cardiac issue, heart attack, right? We see pain along the arm, right? This is the right arm, but generally the symptoms occur along the left arm, right? But we see pain along the arm, which follows the course of the primary channel. We see pain in the jaw for many people, right? Which could be connected to the Luo channel or the divergent channel. And we see often gastrointestinal issues or abdominal pain, which, as we see here, could be connected to the pathway of the sinew channel, the muscle channel. So the sinew channel begins at the radial aspect of the little finger and binds at the pisiform bone, moves along the anterior-medial surface of the upper extremity and binds at the elbow and then the axilla, enters the axilla, crosses the chest to the center, and then descends to connect with the belly button, with the umbilicus. And there's your sinew channel. We have 5 principal functions of the heart, the organ itself. The heart governs the blood and blood vessels, houses the shen, right, our consciousness, our spirit, opens into the tongue, and governs sweating. So if you think of the functions, according to Peter Dedman and Mazen al-Kafaji, in a manual of acupuncture, if you think of the functions of the heart, then the points along the heart channel will encompass those functions. So all the points on the channel can treat pain of the heart or chest, or arrhythmias, disorders of heart rhythm, too fast, too slow, missing beats, skipping beats, right? Except for heart 2. The points on the channel calm the spirit, treat speech disorders because of its connection to the tongue, eye disorders because we see that there's a connection to the eye, and disorders of the complexion. We can look here. I said there are 5 functions, and I just realized that there are 4 listed here. So the 5th function is manifesting in the complexion. So we see the health of the heart manifested in the complexion. We can also see some pathology manifest in the complexion, as in paleness, gray pallor, flushing, things of that nature. So governing the blood and blood vessels, housing the shen, our spirit, opening into the tongue, governing sweating, manifesting in the complexion. And by virtue of these functions, the points on the channel can have an effect in treating heart pain or chest pain or arrhythmia, except for heart 2. The points on the channel can calm the spirit, treat speech disorders, eye disorders, and disorders of the complexion. Let's take a look at some points, shall we? So our main points are the points that we want to look at in the heart channel. Our entry point is heart 1. Remember, an entry point is where the chi of the channel first becomes accessible to us at the surface, right, where the qi enters the superficial area of the channel so that we have access. Right? The entry point is heart 1. It's not always where the channel begins. Our entry point is heart 1. Exit point, heart 9. There's a very small branch, right, from heart 9 to small intestine 1. Heart 9 being on the radial side of the pinky of the little finger, or the 5th digit, and small intestine 1 being at the nail root on the lateral side of the small finger, or on the ulnar side of the small finger. Our Shi cleft point is heart 6. Our Yuan source point is heart 7. As this is a yin channel, our Yuan source point is also our Shu stream point. Okay. Our Jing well, heart 9, associated with wood. Ying spring, heart 8, associated with fire. This is the Harari point, the fire point on the fire channel. Shu stream, heart 7, so the Yuan source point associated with earth. The Jing river, heart 4, associated with metal. And the Hasi point is heart 3, associated with water. Luo point, connecting point, is heart 5. Front Mu point is Ren 14, or conception vessel 14. And the back Shu point, urinary bladder 15. Heart 1. Jichuan, supreme spring. When the arm is abducted, the point is in the center of the axilla. So we can see, right, the arm abducted, right, taken away from the body, and the point in the center of the axilla. Actions. Nourishes the heart yin and clears empty heat. Nourishes heart yin, clears empty heat. Pain in the costal and cardiac regions, so around the ribs and heart. Scrofula, which is swelling of the neck. Cold pain of the elbow and arm, and dryness of the throat. For a long time, this point was never used. It is medial to the axillary artery. So when you're palpating, again, you have to use care and caution. You don't want to just take your thumb and stick it in there. There are a lot of nerves that come out through the axilla, blood vessels, right? You want to use care. And we'll review in class the proper techniques for palpation of this point.